May is Mental Health Awareness Month, and right now many families are asking the same questions. How do we raise resilient children, and what can we do to support their emotional well-being? I know I wonder that about my own kiddos. Here with some advice is Dr. Kerry Horrell with the Menninger Clinic. Welcome, and thank you for being here.
Thanks for having me.
Well, school is about to let out, but that, it depends on the kiddo, I guess, if that helps or makes them feel isolated, right?
Yeah, absolutely. For some kids, it means more sleep, less social pressure, some time to recoup. For other kids, it might mean more loneliness, more isolation, so it totally depends on the kid.
Well, let's hop right into those tips to help make our kiddos more resilient. What are your best bets that might help a lot of kids out there?
Yeah, I think one of the first places to start is that even resilient kids struggle, and a lot of times being resilient means learning how to deal with the struggle. So resiliency starts with connection. It starts with knowing that you have a safe place to talk about things, building that culture in your home. It also means knowing how to do emotion regulation. So emotion regulation starts with being able to identify when you're having an emotion, know what to do to process and cope with that emotion, and be expecting that emotions are normal. So a lot of this is building in those practices at home where you know how to talk about feelings, you have that safe space to talk about feelings, and again, we know that we also want to help our kids learn how to not feel like failing, making mistakes is a bad thing. So we give them opportunities to try things, learn from their mistakes without it feeling like that's a huge problem.
Yeah, it's okay to make a mistake. Just don't do it again if you can help it, right?
Learn
so that's
from
good.
it.
But with parents, we talked about that list. How do you really help your kids learn those different things? How to regulate those emotions?
Yeah.
Because I think that is sometimes very difficult in this busy world to figure out how to do it right.
Yes, and really emotional well-being and learning how to do this, it's in the everyday moments. These are in the moments at the dinner table. These are in the ways that we model how we regulate our frustration, our stress, how we talk about that with our kids. And so ultimately, it really has to do with, again, are we available for our kids to talk about these things? Are we modeling this? And then another big piece is when we're listening to our kids when they're talking, we don't go into any urgency to fix, which is really hard to do. We love our kids. We don't want to see them struggle, but we really don't want to go into, well, have you tried this? Have you tried this? Can we do this? We want to listen. We want to empathize and sort of put that as the priority.
I feel like anybody who has a teenager knows that the universal answer is I'm okay.
Yes.
But sometimes we know they're not okay. What are some of those warning signs you want us to look out for?
Really, we want to look for changes in baseline. So baseline for things like sleep, appetite, their mood, their social engagement. So you know your kid best, and so you want to be thinking about, okay, are we saying they're doing something pretty different than their baseline? Because for teenagers especially, it's not that uncommon that they're going to be irritable or they're going to have some moody days, but we're really looking for consistent changes from baseline that, hey, something might be going on and it might be time to really ask those questions.
So important to realize if you can't figure this out on your own and you keep continuing to see your kiddos struggle, help is everywhere, right? And it's getting more affordable every day. Insurance is covering it more every day, I feel like.
Yes, and really, when kids are starting, we're seeing actual changes in their functioning. They're not going to school, they're having more troubles with school, they're really struggling to keep up with their friends or their social functioning. We are seeing dips in their health, like their sleep or their food intake. This is when there really is a clear sign to get help. And one thing we always want parents to remember is you don't have to wait till the crisis to get help. Early intervention can make a huge difference in being able to catch these things and intervene quicker so that, again, they struggle less.
And I hope with all the kiddos getting more sleep, they can just relax a little bit very soon with school about to let out. But for those kids who are struggling because they feel like they're isolated from their friends, is it important to try to make sure that they try to get some, scheduled time with their friends?
Absolutely. Summer is one of those times where, again, it can get sort of wonky with routines. Kids really thrive in routines, so having things that are going on in the summer that, again, give some of that flexibility that the school year doesn't allow, but there's still some routines, some consistency in regard to social connection, activities, meal times with the family. Those can be really important things to kind of give kids that structure they're looking for.
I love this conversation. I think it's so important for us to just really make sure those kiddos are doing okay, even when they say they are. We know they're not. Dr. Horrell, thank you for your time for Menninger Clinic.
Thank you so much
to help our community.